I want to take a moment to thank all of our speakers for their engaging and informative presentations today. They're spurring a lot of conversation, and I want to, before we get to the Q&A, remind our audience that please put your questions in the text box in the live stream. If you can't see that box, you'll need to get out of the video full screen mode, and then you'll see it. So please go in there. We have some to start off with. We'd love everybody to ask any additional others. So now we're going to begin this Q&A session. So please turn on your cameras to my speakers, and we're going to address some of these questions asked. The first one: what role do travel restrictions serve in preventing the spread of variants, given that dominant variants are going to become dominant once they're in a country, inevitably because of how these variants work? Does this process just delay the process essentially for variant spreading? So thoughts, anybody?
So maybe I'll start if I understand the question correctly. As we talked about, if we're dealing with countries, we have the country of origin and the destination country. And I think our two biggest concerns are, introducing the virus in general, and then introducing a new variant of concern. And I suppose, there are really two ways that this can happen. If in your individual country, there is unmitigated viral replication, so you have large outbreaks and you don't have vaccine, then it's actually much more likely that a variant of concern will arise in your country than come in from somewhere else. There is also the possibility that a version of a variant of concern, that these mutations are arising independently as well. So again, I think it's not one size fits all. Vaccination overall is going to help. And again, we've talked about some measures here where if you have a country with very high rates of any disease, then they will be more a risk to everyone. This is why this has to be a global response. It absolutely has to be a global response.
Yeah, I would agree with that. And I really do think that there has been a lot of focus on just blanket travel restrictions in some cases. And in most of these cases, it's often too little too late. The US early on implemented in late January travel restrictions from China. At that point, we already had SARS coronavirus spreading within the community undetected. By the time you recognize that a variant has emerged, exactly as Kathy said, in a country with uncontrolled transmission, a high number of cases, that's where the variant's going to emerge. By the time you recognize that that's what's happened, that variant probably has already been exported elsewhere, which is why these blanket travel restrictions saying that if you're from this country, you just can't travel, they're really not very effective, because also in many cases, those don't take into account connecting flights, the fact that people could be leaving those countries, going to other countries, and then traveling into a country. So we really do need to apply multiple measures, as Kathy said, rather than just relying on blanket travel restrictions to keep new variants out.
Thank you. And we have another one that's actually both for you, Angie and Kathy. A key question is whether or not the isolation end date for non-vaccinated persons needs to be extended beyond 10 days. What are your thoughts on that?
I don't think that, in my opinion, I don't think that it does, because we do know that people, again, as I presented, are most contagious immediately prior to symptom onset and shortly afterwards. I think if somebody is, and I guess by isolation, do you mean somebody who actually is a confirmed case, or do you mean somebody in a travel mandated quarantine? Okay, yeah, 10 days. I mean, after symptoms begin to resolve, like at least to my knowledge, I'm not aware of onward transmission occurring from people who, again, do have symptoms resolving after 10 days.
Yeah, I would agree with that as a principle. You know, there may be certain highly immunosuppressed populations, for example, where that would just be a very unique case. But on a population basis and population policy, I would agree it would not need to be extended.
Thank you both. And I'm going to turn it over to Garrett, who I believe had a comment as well.
Sorry, I was just going to note that I think maybe it's important just to note that if we look at not just the blanket restrictions, but also the access that countries have and the inequitable access to vaccines and lab testing, it's important to note that people have to travel for a variety of reasons, and it's important to ensure that we reduce the risk as much as possible, but also recognize that unfortunately, not everyone has access to vaccinations in the same degree that some countries do, and that as risk reduction measures, there are opportunities here to ensure that the documentation is there and that then people are still able to travel, but reducing the risk to a tolerable level so that, and part of the reason why we don't, as WHO, we encourage countries not to require the vaccination certificate as a point of entry is because there are different means, for example, the ability to quarantine for a period of time so that it will still allow them to travel, but will reduce the risk appropriately. Thanks.
Thank you, Garrett. And to follow up on that, do you think with the changes we're seeing with the Delta variant, that's likely to change at any point, meaning the WHO's recommendations about vaccines and entry into a country?
So actually, I'll just note that our certificate is, it just represents whether or not someone has been vaccinated. The interpretation of it is, will be according to the country, and the guidance from WHO doesn't yet exist related to that. So I'd leave it up to my colleagues who are focused on the guidance related to that. And unfortunately, at this point, I'm really just focused on ensuring that we have the appropriate standards for certificates and the digital representation. So thanks.
Thank you. Next question from the audience. The Biden administration started work on vaccine certificate standards, but has not issued anything, allowing private entities which may have ulterior motives to set the standards. Will the issuance of WHO guidance move this administration to act?
Well, there are former people in the former administration that have been that I see on the call. The private sector has tried. The International Chamber of Commerce has supported this AOK Pass. There have been some other pieces that have come through different sectors. Yeah, I certainly would like to see, as I've sort of suggested, the health diplomacy approach. And yes, the U.S. is a member state of WHO in a very strong way now. So perhaps there'll be a little bit more of that opportunity to highlight. I don't know what's coming out on Friday. Garrett has suggested some of that, but it's great to hear that we have the standard. It seems to me what I've heard also from Israel that Israel joining the Green Pass, or the Green Pass joining the EU scheme, and others are starting to show that these things can go beyond necessarily competent authorities in one given region. So I'm hopeful, and I think we all have to turn up the advocacy and noise level of the importance to get a standardized approach here in the United States.
Thank you. I have a question to Mr. Cutler. Where are you now with requiring foreign nationals to carry a digital vaccination credential? How long do you anticipate that American paper certificates will continue to be accepted at local venues?
So currently, in terms of local venues, we're issuing parallel domestic certificates to travelers. The US CDC card is an unsecured document for the most part, fairly easily forged. And so until we reach a point where we're recognizing foreign credentials, be that US, European, or any other country. We are at a stage where we're, in a sense, validating the presence of antibodies on the basis of serological testing. So a traveler would arrive here, would perform a serological test showing that they have the presence of antibodies. We would use that as supporting evidence for the unsecured documentation they might have brought and issue a local green pass for them to access different venues here. The length of time that we'll apply that for is really dependent both on the infection rates here and infection rates globally, as well as the efficacy of the vaccine, the period of efficacy of the vaccine. So at this stage, we're in a process of reintroducing the green pass for domestic use. And hopefully, in the not too distant future, we'll be able to phase that out again when it becomes unnecessary.
Thank you. And I believe, Garrett, you raised your hand.
Yeah, I was just going to note on the previous question, I think it's important that where countries are decentralized at a state level, I think in the case of the US, and also where there's a very, I would say, active private sector role, I think ensuring that there is a standard that the federal government recommends in terms of the minimum data set and also how the data is protected will ensure the trust in the certificates and the issuance of certificates and where the data is held and how it's used. I think without that transparency really upfront, I think it really is challenging to imagine that the public would trust not only in the vaccination, but also in the certificates and how the data will be used. So I think there is value, and we're certainly encouraging through the guidance, the sort of ethical principles around ensuring that individuals are shared, how the data will be used, who will have access to it, and how they, as patients, will trust in the system as well as in the certificates themselves. Thanks.
Thank you. And actually, a follow-up question for you from the audience is, what have your experiences with the private sector been in this situation? And do you foresee a lot of partnerships moving forward?
Is that to me, Saskia?
Yes.
Yeah, I think the private sector obviously plays a huge role in both innovation as well as ensuring that there are business models to ensure that there's uptake and that private sector can very rapidly develop solutions that meet specifications. I think in the absence of the specifications, it's been challenging for private sector, I think. And so oftentimes there's one trying to outcompete another. In this case, where there is a spec, we hope that will ensure that there is a description of what is expected with the certificate and how the tools will work, so that they can all be accepted by other countries. I think our experience in general with the private sector has been they can be a very effective partner in this area, and we've seen that in many countries, and we see that in the United States as well. And I think in the case of the United States, as I understand it, there is an entity that is helping to, or maybe multiple entities that are helping to establish a minimum requirement. And I know MITRE is involved in working with the private sector and trying to get that quality across the different parties. And I think that threshold and ensuring that those private sector parties can meet that threshold also will engender trust, I think, in the public as well. Thanks.
Thank you. We have a question for Dr. Ratson. Clear and consistent communication from public health authorities would seem to be an essential requirement. Now the paucity of evidence about the length/duration of vaccine efficacy against the Delta variant presents a challenge. How do you recommend such uncertainty and the likelihood for updated, altered messages to be handled?
I mean, that's an excellent question, and I think we've had challenges that we've alternated, shall we say, even of the spokespeople, and having different messages in the last few days, or that have come both from, and I'm living in the United States, both from Washington with the Surgeon General and the CDC and others. So what we've called for is really, yes, we need to have a trusted, validated source of information, much of which of the work as the National Academies, how we even would communicate out from here. So it is not so simple that you could just say, right now, just as if we would start from ground zero and make a change. We need to start to now show that this is incremental, and that we're going to continue to have transparency to give the data as we know it, and also share that with a lot of these other channels in ways also that we're getting the same or similar people and perspectives. So we're not only relying on infectious disease experts, but we might need more from the public health side, or we're not only relying on elected officials when we know, frankly, that the most trustworthy people that can communicate this are in the medical profession and those at academic institutions. So there are ways that it's not just a message, but the messenger. And I think that's what we can also, shall we say, do better at. And then they also add in what Garrett just said with, if you don't mind, on the private sector. So I also lead this effort called Business Partners to Convince, which links with these global networks of, it's the US Council for International Business that links with the business at the OECD, the International Chamber of Commerce, International Organization of Employers. We're similarly having discussions like this. But yet there hasn't been, I don't believe, unless Garrett and others know, of any of these one groups saying, no, we agree upon what the standard set is. And we're able to also support the effort. So when something comes out, whether it's the new verification credential, whatever it might be, that you also get support from multiple layers in society, because people all don't just read or listen to network news or the social media. So that would be the piece I would certainly say that we could do better at as well.
Thank you. And I am going to remind people that tomorrow we'll actually be talking about verifiability, but we did get a couple of questions in it, and I'm curious to hear this group's thoughts. So can you talk about vaccine certificate fraud and how concerned government should be about detecting fraudulent proofs of vaccines or negative tests? Who uses fraudulent documents? People who are knowingly sick, or maybe you just want to travel, people who don't necessarily want to pay for private testing, anti-vaxxers, et cetera. What are your concerns on that? And are we truly, from a government perspective, at risk for a lot of fraudulent vaccine and testing data, or proof, I should say?
I don't know who you are aiming at that. I think it's a huge concern. I think that, Adam said it in a nice way, the unsecured document by little white card. I mean, could we have done better? And the verification schemes. I think we're seeing that. We're hearing about it day in and day out. The Lollapalooza concert, they say we're going to mandate, we cover things, you can buy these things on the street. The fraud is a reality, but I think we can overcome that. I think the systems that Garrett's mentioned, and I think what somebody might have been getting at, where is Google, Facebook, these other groups that also will help us have trust in what comes out of this new global certification, or even local certification. And then the last thing I would just say with fraud, if people are going to need to have vaccination verification as a condition of work, we should be proud to put a badge on, just like we used to wear the Livestrong bracelets. We should also add that other element. So the social norm is not that I have to hide my vaccine status, but it's just, there. And we can slowly integrate that into our lives, and then fraud will be less of an issue as trust will gain. But this is a long haul. This is a marathon, and I'm glad we're talking about all these different aspects at this point.
I'll just make a quick point about fraud. Over the course of the last year and a half, we've encountered a high level or higher than we'd have liked to see level of fraud, whether that is PCR testing, serological testing, or otherwise. I believe that to a certain extent, it's a function of enforcement. So while the level of fraud may be tolerable on a systemic level, we don't want to get to a point where enforcement becomes so lax that fraud becomes encouraged and normalized. So we're very concerned that whatever systems we develop or recognize have a robust anti-fraud component.
Thank you. And actually, Adam, I have a follow-up question that was posed to you. What has been your experience in moving from a domestically focused system to one that has to be interoperable with international systems, or rather domestic systems of international partners?
So with our vaccination certificate, it was developed with the international realm in mind from the beginning. The domestic system is running in parallel and is remaining domestic. When we developed it, we knew that there would be a process where the world coalesces around certain standards, and we didn't expect to be able to set those standards ourselves. So we knew that we'd have to adapt. And while I do think that the European Union in particular was very transparent in communicating those standards as it developed them, we are playing a bit of catch up where European members were onboarded first and the European neighborhood countries were sort of left to catch up. We are optimistic that we'll be able to close that gap within a number of weeks. So very optimistic.
Thank you. And a question for Angie and Kathy. Are recovery certificates being considered? How long should vaccination recovery certificates be valid, in your opinion?
Well, I can start. In my opinion, I don't know that recovery certificates are actually very valuable. And one of the reasons for that is that, yes, and most people who do recover from SARS coronavirus 2, they will have detectable antibodies, they will have residual immunity from that first infection, but the spectrum of protectiveness of that immunity is really unknown, and it's much wider than for vaccination. And that is the reason why people who have had SARS coronavirus 2 or have recovered from COVID are being recommended to still get vaccinated anyways. I think that we should not regard recovery and natural immunity as the same as vaccination, simply because we haven't evaluated whether that natural immunity is at population level as protective as vaccination, as we know vaccination to be. So for that reason, I don't think that recovery passports or immunity passports for any immunity are as valuable as a record of vaccination, because we should still be encouraging people to be vaccinated regardless of whether they've had COVID or not.
Yeah, I would agree. And the only place I might make an exception are these countries that have no or, almost no vaccine. As Angie nicely articulates, yeah, even in that circumstance, it would likely have to be for a relatively brief period of time. But we do have to remember most of the world doesn't have access to vaccines.
Thank you. And for our last question today, we had a follow-up for Dr. Scott on boosters. Do we start laying the groundwork now, not knowing if they'll be needed, or remain silent, but run the risk of a sudden requirement for a booster for those vaccinated more than, say, 9 months ago?
The answer is yes, yes, and yes. We need to first communicate what a booster is, and that people understand what that means, so they're not online to get it before they need it. Luckily, at least here in the United States, right, their access or the supply is not as much of an issue. I mean, the second thing we ought to be thinking about is seasonal flu vaccination. We have a target of 70% in healthy people 2030. We've never met that in the United States. We could start to tie boosters there, certainly for the over 65 population, and think about other ways to do it. I've seen some surveys that show if you do tie a booster to a seasonal flu immunization, it's about 3 or 4% higher, at least in terms of intent to vaccinate. So there are also values of how we can do that. And we may have to have this into our ongoing preventive measures. So we're suggesting to tie it into other health literacy, whether they're annual checkups and so forth, particularly as you go to the pediatric population. So the answer is boosters need to be communicated well, just as the other aspects of the vaccine.
Thank you. And with that, I want to thank all of our speakers and the audience for attending today. And please be aware and attend tomorrow at 11 a.m. Eastern Standard Time. We have sessions on data sources, security, privacy, interoperability, and verifiability, as well as a panel of experts who are ready and excited to answer your questions just like today. So thank you all for providing your insight and wisdom. It's truly appreciated, and look forward to seeing you tomorrow.